Hello everybody, it's Melissa Cady, the Challenge Doctor, and I wanted to just let you know about a book I just finished reading, and the name of it, if you can see it, is called Back Mechanic, and the subtitle is The Secrets to a Healthy Spine Your Doctor Isn't Telling You, and this is by Stuart McGill. He's a researcher. He's out of Canada, and I just finished reading it. Fantastic book for anyone that has back pain. Here's a very important point. Most physicians, believe it or not, are not taught in biomechanics. And the reason I make such emphasis on this, it's one of my biggest pet peeves of our industry, is because there is a huge focus on opioids and all this epidemic, and I speak about it in my book, Paindemic. But the reality is that we're treating symptoms. And when people start giving you pain medication to cover up the pain, it's because they're not really able to understand why you have the problem, or they just want to give you a bridge. But unfortunately, it ends up being a train you're on because a lot of times people don't get off those medicines. So the hard truth is that you need to have someone who's trained in biomechanics, so you try to rule out the most obvious reversible, potentially reversible back pain or mechanical pain first before you go into all the symptom-oriented treatments or long-term treatments in a symptom-oriented way. So some physical therapists are great at it, some chiropractors are great at it, some osteopathic physicians are great at it. Not everyone's going to have the same skill level, but if you really want to get to the root of what's going on, there are a lot of good books out there, a lot of great professionals. Obviously, the key is that this is not just a quick fix. It takes work. It can be difficult. A lot of times it's a journey because you're trying to figure out what are the tendencies of your body, what are the triggers. So a little bit of an evaluation, reassessment. So this is extraordinarily important, and it is always I wouldn't say always, many times it is not well understood by primary care physicians. And it's not their fault. They don't get the training. So unfortunately, who suffers? It's the patients. So if you have back pain, it really would behoove you to actually get some assessment of your biomechanics. Make sure it's not something reversible. Believe it or not, that's something that'll come up in future Facebook Lives that I'm going to be having and some other products to educate people. But I just wanted to remind you that if you have back pain, you gotta find out if there's reversible mechanical components. And if you don't know what I mean by that, and your physician doesn't, then you definitely need to get an assessment, maybe by a physical therapist who's advanced in their training. And there's some other great practitioners as well. So just wanted to give you that tidbit because that can lead you down a totally different path and avoid a lot of the issues that end up being potentially opioids and dependence or addiction. So on a Friday night, I hope you all have a wonderful weekend, and remember to challenge your health before your health challenges you, and I'll see you again in another Facebook Live. Bye-bye.